That's the image of the right atrium. So you just spin it around. So we created a shell. And then now we're going to start ablating.
Yep, so I'm Mark Lee, and I'm the Director of Electrophysiology here at MemorialCare Heart and Vascular Institute at Long Beach Medical Center. Yeah, so atrial fibrillation is the most common heart rhythm disorder in the US. It affects approximately 10 million Americans at this point, and that number is expected to grow now that we have good detection tools like the Apple Watch. It's a rhythm that's important for several reasons. Number one is that it can increase your risk for stroke. So for that reason, we may need to place you on blood thinners if you have risk factors that increase your risk for stroke. The other reason why we care about AFib is that it can cause symptoms. Fatigue, shortness of breath, chest tightness are very common symptoms. For several reasons, AFib is something that we want to monitor and capture early. Fortunately, it's not a life-threatening rhythm, but because of the stroke risk and symptoms, we do want you to notify us as soon as you feel something awry. An ablation is one of the modalities or treatment therapies that we offer. There's medication approaches that patients may qualify as well, but today the patient has decided on an ablation. And ablation is the most definitive therapy that we have for AFib. It's a procedure that we call minimally invasive, and we go from the right groin inside of the heart. AFib arises from the left atrium, so we will cross into that chamber of the heart and create a shell of the heart. So we'll use essentially a paintbrush to create a geometric and anatomic shell of that chamber. And then I'll use cauterization, whether it's freezing or heating, to purposely and intentionally scar the tissue in a specific area called the pulmonary veins. So that's what we're trying to achieve today. This procedure has a relatively high success rate if patients are detected early.
And then now we're going to start ablating. Okay, that little circle there is the valve. And then Jackie's going to give me 2 views of this now.
Patients should notify their primary care physicians if they want to be seen immediately, get an EKG, because that is the tool that's going to define and detect atrial fibrillation immediately. However, if they want additional therapies and want to see a cardiologist, they should reach out to the MemorialCare Heart and Vascular Institute at Long Beach Medical Center. We have multiple cardiologists and electrophysiologists like myself who can guide them to the right therapies.